Inside High School Sports Show, brought to you by SummitCars.com.
All right, welcome back to the program. We're talking SOS talented Todd Battaglia. Todd, how are you?
Doing well, Mike. You hear me okay?
Yeah, I got you loud and clear, and I appreciate you actually taking a few minutes on the program. And selfishly, I'm going to ask you about some of my ailments and let me know what you think you can do, and everybody can hear about those. So, played basketball for years. Left ankle, I probably had at least 8 high ankle sprains between both ankles, both feet over the years. Left ankle, I don't know, it's inflamed on the top. I went and I got a cortisone shot with you guys. I felt like a Superman for a long time. It's starting to hurt again. I'm a little worried that I might need some surgery here or something else. What do you do in those cases when you have that chronic pain? Cortisone does work for a while, and then all of a sudden you start feeling it come back again.
When you had it looked at, they get x-rays, tell you much about how much arthritis you had in that thing?
Yeah, Dr. Lemon actually said that not much arthritis whatsoever. He was surprised. He's like, hey, these look pretty good.
That's good to hear, because if the arthritis is bad, your options are pretty limited. You can, if it gets to the point you need a surgery and you're bone-on-bone arthritis in an ankle, you can basically have it fused, which means they basically get the 2 bones of the ankle to grow together, so there's just no more joint there, and then obviously you lose a lot of motion and mobility. Or you can have an ankle replacement, which is not as common as knee replacements and hip replacements. They're becoming a bit more common, but they're certainly not. The technology and performance is not there for the other joints. So if your arthritis isn't bad and you get to a point where you need something done, you might be a candidate for just an arthroscopy, kind of clean up the joint, smooth any rough spots, get any scar tissue out that's built up over the years from all your ankle sprains.
What about the PRP, the blood plasma? Like, how does that work? The platelets?
Yep. So that's a good question that we don't really know all the answers to yet. So PRP stands for platelet-rich plasma. It's basically an injection, kind of in the category or family of stem cells that you hear about. It's a relatively lower family member in that, where we take some blood directly out of the patient, and then we put it into a centrifuge and spin it around for a little while, and it separates out the layer of blood that sort of has all the growth factors in it. And so over the last probably 5-10 years, people have been trying injections of that PRP for almost every orthopedic issue you can think of. Does it make rotator cuff surgeries heal faster? Does it make your ACL surgery heal faster? A lot of stuff it hasn't really panned out for, but the 2 areas where it does seem to have some real use, at least right now, is for sort of chronic tendinitis issues like Achilles tendinitis, tennis elbow, patellar tendinitis kind of thing, and also for low levels of arthritis. It actually seems to have better and longer-lasting effects in relieving some of those symptoms than the cortisone shots and the gel shots, those other things we use.
You just mentioned the tennis elbow. I've got worse tennis elbow on the left arm. That could be a candidate, I guess.
It could be a candidate. And tennis elbow is one of those things where we basically try everything we can to not have to operate on it. It turns out that the people who get surgery for tennis elbow and the people that don't, the results are very similar. It's just not a home run surgery. So we really try to exhaust every possibility before we operate on somebody for tennis elbow.
What goes into tennis elbow? Is that just a tendon that starts fraying and eventually breaks down, or what exactly is tennis elbow?
That's exactly what it is. It's all the muscles on the back side of your forearm. So all the muscles that pull your wrist back, straighten your fingers, they all connect right up to that outer bump on the side of your elbow, and it's just overuse. The chronic pull, it's called tennis elbow because the way tennis players sort of snap the racket on the backhand puts a lot of stress there. But the great majority of people who get it aren't tennis players. It's just people who lift or play sports, and it's just a chronic tendinitis, and it breaks down right there.
I've done Graston for a bunch of years on Achilles and calves and things like that, and I've been told that for tennis elbow that could possibly work. What do you think about those techniques, the Graston with the ceramic tools or metal tools, and trying to create lineage and breaking down scar tissue, things like that?
Yeah, so for folks that don't know, Graston is just a therapy technique that uses almost like these fancy tools that look like ice scrapers for your windshield. And it's basically exactly as you said, trying to break up the scar tissue and sort of create a low-level trauma to stimulate some healing, create blood flow, create irritation there, and try to get your body to heal that. They're very useful. They obviously don't work for everybody, but they're sort of mainstays of treatment of soft tissue injuries, muscle and tendon type stuff.
So we're talking to Todd Battaglia, Syracuse orthopedic specialist, and Todd works as well with the football team. So now here you are on the sidelines working with, these Division I athletes. You can watch football on TV, but it's nothing like when you're on the sidelines and you see everything up close and the speed. Can you talk about that?
Yeah, again, I think you're spot on. You get so much more of an appreciation, and there's just so much more impressiveness at how big these guys are and how hard they hit each other. 250, 300-pound guy moving at, that can run a 4.8 or a 5.0, going at each other full speed. It's just so incredibly violent. And as much as I hate to admit my dad was right, maybe he was smart keeping 5'8" me off the football field when I was growing up.
Well, you're a Marcellus Mustang guy and a lacrosse player, soccer player, as well as a basketball player, and three-sport athlete. And I got to imagine that those being athletic and understanding how sports work has been probably a perfect seam into working with athletes and what you're doing with SOS and working with the football team and stuff like that. You can see the injuries. You understand what's going on. You understand the sports side. I got to imagine that's helped so much, kind of being an athlete as well as working with athletes.
Yeah, it does. I mean, I think, at least gives you a little bit of appreciation, particularly for the mental side of, what these guys go through when they get injured and how important sports are to them and, how their focus is on how quickly I can get back and play. And the other good thing about it is from a personal standpoint, it's fun. I like what I do day to day, but there's no doubt that being able to sort of be part of the team and travel with the guys and, that camaraderie that obviously don't get when you're 50 years old anymore from actually playing on a team. Right. It keeps you energized and keeps you happy with your job.
And pretty cool having that ability, that family. And then you have the SOS family with the rest of the doctors you work with Mike Humphrey and with Nicole and everybody. Talk about the SOS family and, the team you guys have there and how incredible it's been.
Yeah, so SOS, from a distance, is a very impressive organization. The folks you mentioned, Mike Humphrey is our CEO. Nicole Tidsey does our marketing stuff. Very good at that. We've got a core of providers. Can't give you the exact numbers, but I want to say we're about 25 strong now in terms of doctors covering basically every aspect of the orthopedic spectrum, from spine to foot and ankle specialist to hand specialist to our top-notch sports department. But we've also, we try to cover everything in the orthopedic world. From imaging, we've got a great MRI system. We have a very big physical therapy program now with multiple offices. We've got a relatively new 2-year-old or so surgery center now that is ours and allows us to do a lot of surgeries that used to be done in the hospital as an outpatient, particularly shoulder and knee and hip replacements. So we've got a very good organization that tries to cover everything from head to toe.
How can people obviously get a hold of you, ask questions, get your insight? Someone's got a nagging injury, someone's hurt an ankle, torn an ACL, whatever it might be. How can they get a hold of you, or how can they get some information?
Yep, any way they want to think of. Obviously, they can call our main SOS number, and our folks up front will hook them up with whoever the appropriate doctor is. We've got a very robust website that they can log on to, actually send questions, request appointments. And then for me personally as well, I've got a website where I can be reached via email, where I've got a lot of information up there about various injuries. Just simply my first and last names, MD, Todd Battaglia, MD.com. So basically any way they want to get in touch with us, we should have it covered.
And Todd, real quick, Todd Battaglia, MD.com, real quick. What would your expertise or combination of expertise be?
So my personal expertise is, like all of my partners, I'm board certified in orthopedic surgery, and then nearly all of us have a subspecialty. Mine is sports medicine, which is an additional board certification, and my practice mostly focuses on knee and shoulder surgery, pretty much everything from basic arthroscopy to complex ligament reconstructions, and then sort of general sports injuries beyond that, Achilles ruptures and, Tommy John injuries to the elbow. But about 90% of my work is shoulder and knee.
Todd, obviously I appreciate the insight, and if I wasn't doing this, I feel like I'd be a PT. I'm so interested in this, and I think it's so fascinating what you guys do and how you get people back and injury free and back healthy and all that kind of stuff. And the surgery piece to me is so fascinating. What you guys are able to do, very impressive.
Appreciate it. Great show. Love listening to you. Thanks for the opportunity, Mike.
Thanks, Todd. Talk to you soon.
See you, buddy.
Todd Battaglia here on the program, Syracuse orthopedic specialist. Absolutely love that stuff, and he gives so much insight, and what a talented doctor and smart guy. We'll be right back. ESPN Radio 97.7, 100.1. 97.7, 100.1.